We work in the ABMU Children's Centre in Singleton Hospital in Swansea, where we work with a multidisciplinary team seeing children from 0 to 19 years with a variety of medical conditions.
We are a physiotherapist and occupational therapist.
So we work together with the local education authority to support teachers to support children with motor coordination difficulties, and then within our team we're supporting the multidisciplinary team to ensure that we're seeing children whose needs are the greatest. So we've been working on the project for over 15 years, so we've been constantly amending and adapting it to meet the demands of current need today.
I think we were nominated because we're a really close team, we work really well together, and I think we put the needs of our client group, for the young people who stammer, I think we put their needs first, and we're very patient-centred.
Yeah, absolutely. I would say that everything that we do is about working together with somebody, whether it's working together with schools, working together with parents, working together with the young people. We couldn't do what we do without working together with someone.
And I'd just like to add that management are really supportive of us and really allow us to think outside the box and work outside the box. We can take our clients to restaurants. Some of the girls we've worked with find it really difficult to ask to change outfits in a shop, and they also support us in developing our skills, attending clinical excellence network meetings and postgraduate training and so forth. So I think we all work together, from line management to as therapists to families to everybody, really, all as a team.
It's the essence of what we do, working with someone.
We are a multidisciplinary team working at Neath Talbot Hospital with elderly patients. We conducted a pilot study on one of the wards, which was to address the length of stay and the dependence that patients were having on the hospital staff while they were staying with us, and the increased dependence on social care on discharge. We co-produced with the patients to provide the service that they felt was most beneficial to them, working on their specific goals to ensure that they had the best possible outcome on discharge. We know that we made a difference with the pilot project by the outcome measures that we collected. We looked at our average length of stay for the ward. This almost halved compared to length of stay prior to the project. The functional measures that we collected for the patients improved in every case for patients on discharge. This meant that they required less care when they were discharged into the community. We also collected this data, which showed a significant decrease in the dependence on social services. We also captured friends and family feedback, which we ranked highly across the trust throughout the project, with quotes from patients such like that the pilot project made them feel more human.
The team I work for consists of physiotherapists, occupational therapists and rehabilitation technicians, and we're based on Ward 12 in Singleton Hospital. Where we provide holistic therapeutic rehabilitation for anyone who's admitted to Ward 12 to meet the needs of whatever they require during admission. We do this because we've become one as a team. We're able to provide prompt specialist assessment, rehabilitation, discharge planning and support as and when the patients need it. The one approach that we take as a team allows us to provide this in a timely manner, so it's reducing length of stay for these patients, it's reducing delayed discharge, it's reducing the physical and psychological deterioration of these patients, as well as it's because we work as one, it allows us to provide more time with the carers, and we're able to support them more so they can support their family members when they go home.
We started off looking after the head and neck oncology patients by having 3 individual clinics, one to see a CNS, one to see a dietitian and one to see the speech therapist. Also, the consultants would see these patients routinely throughout their 6 weeks of treatment. What we discovered was we would all say similar things, but the individuals only had to hear a sentence changed and perhaps the message was slightly different. So we got together and looked at how can we benefit these patients, these individuals. And we thought by seeing each other together, we could all look at the same issues, the same message being given from the 3 disciplines, and ensure that the patient's got the right message at the right time. The difference I think we feel that we can make in our role is that patients seem more comfortable by seeing us all together. They know that we're all present, that we answer their questions together on that joint forum. So they're not going to get conflicted information from us. And as I said, it's just one sentence that can be structured in a different way, which can be taken to have different meaning. And it's confusing for individuals when they're already feeling threatened by a cancer diagnosis and a treatment, which is really intense.
I think the other difference that we've made as well is that we've reduced the times that they actually see in the consultant as well. So they were seeing them, like you said, 5 times during the treatment, but we've reduced that down to twice now.